Hi everyone, I'm Tracy Donegan, the founder of GentleBirth. In today's episode, we're going to talk about sweeps. Now, not the cleaning kind or Mary Poppins musical kind, but a medical procedure that is used by some care providers to kickstart your labour. A membrane sweep is defined as a cervical examination with the goal of releasing prostaglandins to start your labour. It is considered a safe option for inducing labour. And sweeps date back centuries, so they're not a new phenomena. As you approach your guest date, you may be offered a vaginal exam to see if you start to dilate, or if you're heading into 41 weeks, it may be offered to you in the hope of avoiding a more involved induction. Your care provider will put on gloves, ask you to remove your underwear, and you lie back and you'll have a vaginal exam. Ideally, your cervix is dilated enough to allow your care provider to insert a fingertip and then sweep in a 360-degree motion to try and separate the amniotic sac. So again, this is an attempt to stimulate hormones to start your labour. If your cervix is not dilated enough to do the sweep, another option is to massage the cervix firmly, which will also release prostaglandins into the bloodstream. And even without massaging, the examination itself does release some prostaglandins. It can be quite uncomfortable, and not all moms are informed that it is about to happen. Sometimes they're informed as it's happening, with the conversation going something like this: I'm just going to give you a good stretch here and see if we can get this labour started. It's one of those deer in the headlight moments, and it's very difficult to refuse the procedure with your care provider's hand in your vagina. Consent must be sought before the examination takes place. So if you prefer not to have this procedure, consider not having the vaginal examination at all. Or if you're curious to see if your cervix is changing, let your care provider know that you prefer not to have a sweep at this time. So you might be wondering, well, if it starts labour and avoids Pitocin or other interventions, what's the harm? So let's have a look at the pros and cons of a sweep, or also known as stripping the membranes. If for whatever reason induction is on the cards for you and you're on the brink of labour, it just might do the trick for you, and you might avoid a more invasive induction such as IV Pitocin or releasing the waters artificially. There is quite a bit of research on membrane sweeping. The research suggests that the main benefits being that if you have a sweep at 41 weeks, it might reduce your chance of going past 42 weeks by about half. And if it's going to work, it'll do so within the next 48 hours. So what are the potential downsides to having this procedure? Well, it can be quite painful, especially if your cervix is far back and hard to reach. Plus, you don't have the benefits of those lovely labour hormones, so it can knock your confidence quite a bit. Sometimes I'll hear moms say, I don't know how I'm going to cope with labour if I couldn't cope with a 1-minute examination. But the cervix can change very quickly, so don't put too much focus on what your cervix is doing today. This examination is just a Polaroid shot of the condition of your cervix today at 2 p.m. in your doctor's office. You could be holding your baby this time tomorrow. And even moms who are examined and told they're already 3 centimeters can still be pregnant at 41 plus weeks. Sweeps can sometimes excite or irritate the uterus, so you may feel some crampiness and think, yes, this is it. And then it all dies down and it just doesn't work. Most moms report having some bleeding too, and around 10% of women experience their waters releasing during the procedure, which then means you're on the clock due to the risk of infection. There is some controversy over the safety of sweeps. If a mom is group B strep positive, and in some countries like Ireland and the UK, moms may not know if they are group B positive as they aren't routinely tested. At the time of this filming, there is no strong evidence either way to recommend specific clinical guidelines as long as the waters aren't released accidentally. So if it looks like a sweep is an option you're considering, here are a few tips. Take long, deep breaths during the examination and try to let your body completely relax. The more you tense up, the more painful it's likely to be. You can always put the GentleBirth app on to take your attention away from the examination. The Labour Companion or slow breathing MP3s are really good for this. It's usually over in less than a minute, and you can do anything for a minute. But if it's too painful, ask your care provider to stop. I hope you found this episode helpful. Drop a comment below and be sure to subscribe for more videos. And don't forget to download the GentleBirth app today for your 7-day free trial. I'll see you the next time on GentleBirth TV.